And we are extremely pleased to welcome you to this second part of our ICHS Talks series. It is about our role in community health. As we wait for a few people to trickle in, please feel free to share in the Q&A where you're joining us from and the organizations or the communities that you represent. I want to thank some of my board members who are on today. Thanks so much for jumping on and joining. I also would really like to start by recognizing our sponsors. A special thank you to Molina and CHPW for sponsoring this virtual Lunch and Learn series. They have been long committed partners and they make this sort of presentation and and activity available to everyone. So thanks for joining us and huge thanks to our sponsors. Few things I would like to address off the top. We will be recording the webinar. You should have gotten the notification that the recording has started. We will share these resources with everyone after the event. Throughout the webinar, please feel free to enter your questions into the Q&A that you will find at the bottom of your Zoom screen. If you are having technical difficulties, you may also drop questions into that Q&A chat. We will do our best to help you solve them. But please first try a quick log out, log back in. You may need to update your Zoom or even reboot your computer. But we can try to help navigate that for you in the Q&A if you need additional support. If we have time, we will facilitate a Q&A session. We do want to get your questions answered. We want to make sure that you are walking away with the information you seek. If we do not have time to address questions directly, we will absolutely be following up with you. There will be an opportunity to submit questions through our survey at the end of the event, which brings me to my last talking point, which is that there will be a survey at the end of the event. You will, we really love to hear your input as to how this format works for you, how the content worked for you, what you may want to hear from us in the future, and then again on anything that we can follow up on for you. So, without any further talking on my part, let's get to what we're really here for. It is my great pleasure to introduce our amazing board foundation executive board president, Jenny Shin. Jenny, take it away.
Thank you, Melissa. Well, hello, everyone. Welcome and good afternoon. Thank you so much for joining us today to learn more about the important challenges and opportunities that we are facing in community health. My name is Jenny Shin, and I serve as the president of the ICHS Foundation Board. The foundation's role is to raise funds for charity care at ICHS, build lasting donor relationships, and to support ICHS capital improvements and expansion efforts. So why do I serve on this board? As a child of immigrants and a fierce public health advocate, I have seen firsthand how health systems can create barriers for those who need support the most. This is especially true for people of color, non-English speakers, and those with limited resources. I serve on this board because I believe in creating a more equitable future where everyone, no matter their background or income, can access the care that they need. ICHS embodies this mission every day, and I am so proud to be a part of it. ICHS currently provides culturally and linguistically appropriate health and wellness services to over 33,000 patients in over 70 languages throughout the Puget Sound region. We currently have 11 sites across King County, and we will be expanding into 2 new locations this year. ICHS at Sound Auburn to expand care in South King County, and the Rancho Healthy Aging and Wellness Center in Beacon Hill, which will expand care to serve hundreds more low-income seniors in the area. Our patients include those who face tremendous barriers to accessing healthcare. These are people living at or below the federal poverty line, people who are uninsured or cannot afford healthcare, and people who face language barriers. And here's what's incredible. ICHS never turns anyone away, and it doesn't matter who they are, what their background is, or whether they can afford to pay. And at the heart of our work is the belief that health is a human right. And while we have many dedicated professionals on the front lines, like doctors and nurses, medical assistants, and community health workers, this work doesn't just belong to those in healthcare or policy. And even if you don't work in this field, each of us has a really important role to play. We thrive as a community when we listen to and engage with one another, when we show compassion, and when we take action to advocate for healthcare for all. And that is why we appreciate you being here today to learn, to reflect, and hopefully to leave with new insight in how you can be a part of this mission and take action. As federal policy changes and funding cuts present new challenges for community health centers, ICHS continues to meet these challenges head-on through innovation and commitment. So thank you again for showing up and being a part of this conversation. A special shout out to those of you who joined us for part one of ICHS Talks. We learned about the ways that we are approaching the behavioral health stigma and how ICHS Community Health Services team is helping patients navigate the complex healthcare system. Today, we are really excited to hear about how ICHS is combating senior social isolation and loneliness. And we will also hear about how ICHS is adapting care models to truly meet patients where they are. So let's take these lessons with us. Let's be inspired, and let's think about how we can break down barriers to healthcare for communities and how we can advocate for healthcare as a human right. Together, in community and partnership and solidarity, we thrive. Thank you.
Thank you, Jenny. That is inspiring, and we do thrive in community. So, thank you so much. We couldn't have a better way to kick this off. To start off our Lunch and Learn series today, we have invited our Chief Operations Officer, Jade East, and our occupational therapist, Kelsey Schultz, to share how we're specifically caring for the needs of elders in our community, which is a really unique aspect to the work that we do. So, I'm going to go ahead and turn it over to Jade. Thanks so much.
Yeah, thank you, Melissa and Jenny. Appreciate that introduction. So we wanted to talk a little bit about combating social isolation and loneliness, just because we know right now in America, it's been a huge epidemic. Right now, they project about 50% of Americans are currently experiencing loneliness or social isolation. Even though we're more connected with technology than ever, at the same time, we're struggling with this epidemic. So we wanted to bring to you the topic of senior isolation and loneliness. So why it matters is it's more than just a feeling, it's growing public health concern spanning all age groups. Older adults are especially vulnerable due to life changes like retirement, loss of loved ones, and health decline. And then understanding the impact can better inform your interventions in the communities that you serve. We also look to the caregivers that provide so much care. Reducing caregiver burnout is a huge opportunity for us in our organization, as well as just us as a community. Many of you might be part of that sandwich generation. They project about 25% of Americans fit into this category where we're struggling with raising our children or family members, and then also taking care of our patients or our parents. So in some cases, even our grandparents. So with time demands, financial strains, emotional and physical strains, our workplace sometimes suffers from that. So our role in health and how we take care of our families is really what we want to get to today. Some key definitions that we'd like to share is from a subjective experience, loneliness is the feeling of being alone or disconnected, lack of meaning or social connection. Social isolation from an objective perspective is lack of social contact or support, leading to loneliness and potentially negative health outcomes. What causes loneliness in seniors primarily is loss of spouse or partners, loss of mobility or hearing impairments. I know I have a family member who lives alone and struggles with hearing. Because of her hearing loss, she has anxiety and social avoidance. And at times she just doesn't want to be out in public because she's worried about mishearing conversations, responding incorrectly. She'd rather stay home and use her iPad than interact with others. And this is not the place where we want our seniors or our family members to live in, to exist in. Some other experiences are lack of transportation or resource constraints. We know serving at a federally qualified health center here, a lot of our patients have these resource constraints. There's retirement, loss of social roles, living alone, major health emergencies. My grandmother had a brain bleed. She was, hard charging, walking 3 miles a day. All of a sudden, she had this health emergency, and it caused her to need permanent assistant, 24/7 assistance, which primarily became my father, essentially. living in a rural area, there wasn't a lot that they could do. There weren't the senior centers that they could tap into, and so it became a struggle for my family to care for my grandmother and ensure that she wasn't experiencing this loneliness. The other factor we'll talk a little bit later about is cultural differences. So how common is loneliness? About 1/3 of older adults experience loneliness regularly, while about 1/4 or more adults over 65 are considered socially isolated. As you can imagine, immigrant seniors are even more likely to experience loneliness. They have the language barriers, cultural differences, separation from extended family, and limited access to culturally appropriate services. So for immigrants, the adult trends are surprising. Currently, approximately 15% of U.S. seniors are immigrants, with higher rates in urban areas. We see that especially here in Seattle, in Bellevue on the east side, and then south King County. By 2060, they're predicting that foreign-born seniors will make up about 25% of the U.S. population. And studies show that immigrant seniors report higher levels of emotional and social loneliness than U.S.-born counterparts. We don't have time today, but I would encourage you to check out, there's a King 5 special called Facing Race. We did a segment on social loneliness, social isolation, and some of the impacts of immigrant families that are navigating our health system. We'll send out the link after this presentation's over with today, but be sure to check it out. It's a great story. There's video involved as well, and it talks you through kind of the life and experience of one of our seniors that we have here at our PACE Center. The health impact, some of the better known health outcome impacts are, mental health, physical health, and sleep overall. If you experience poor sleep, you also have mental health and physical health impacts as well. And then overall, we see a risk in loneliness. CDC and National Institute of Aging has shared that your health risks with regards to dementia goes up by 50% when you experience constant loneliness or social isolation. Similarly, you can see the increase in stroke at 1/3 of an increase. Heart disease and premature death, is over 1/4. And so as we face these this challenging epidemic, we have the ability to affect some of these scores and help our seniors live healthier and better life. Now I'm going to turn it over to Kelsey to talk about what can be done and what we're doing here at ICHS. Kelsey.
Hi, good morning, everyone, and thank you for having me this morning. I've been working at ICHS for over 4 years as an occupational therapist in our adult day services program, as well as our PACE program. Very excited to be here. Brief overview of occupational therapy for those that may not be familiar. Occupation is things that occupy your time. So we look at things that people need to be able to do, things that people want to be able to do, and social participation is actually its own domain in what OT does with patients. So I'm really happy to be talking about this today with you all. We can go to the next slide. So what can be done? Jade's kind of given our risk factors and our concerns for this community, and I'm going to try and give some input on what we are doing, what can be done for our seniors. And so what we can do is get them involved in opportunities to socialize, like getting them into a program like PACE, into their local senior centers, programs like Meals on Wheels, anything to up their likelihood of interacting with others throughout the day or throughout the week. We can work with them on familiarizing with technology, ways to reach out to people, whether that be things like WeChat, that's very popular in our population. Also using social media, getting opportunities to volunteer, give some purpose to their day. And as healthcare providers, it's important for us to consider loneliness in the plans that we lay out for treating our patients. So knowing that, as Jade had said, loneliness can not only affect your mental health, but it does absolutely involve your physical functions. Your medical complexities can worsen. So we want to make sure to take all of that into account to create an individualized plan for each person. Next slide. So how we're putting this into practice in our community, we want to look at the barriers. What's keeping somebody from being able to engage with their environment and with their community? How can we improve their access? How can we give them some meaning and purpose to their day? And how can we help them create connection? And in some cases, that means connecting with us, their providers, but more importantly, connecting with their community, their peers, in our case, in our day center, or their family members. So I want to share a brief story about a woman that I was part of her intake assessment for PACE several years ago. She was living in a home by herself. She kept the windows closed all day, curtains drawn. She had a TV that played English channels only. She couldn't understand that, but she said, well, it's better than just sitting with not hearing anybody. And she basically told us, I just sit and wait to die. And that was a really horrible thing to see. And in her case, what the best move was to get her out of that environment. We have her living here in our assisted living facility, Legacy House. And she now is at the mahjong tables multiple times a day. She's laughing and talking with her neighbors. She's talking about wanting to go out in the community. She says, I want to go buy some new clothes. I want to go to the bank. And so just getting her into a routine and a way of life that involves more interaction throughout the day made such a difference in how she's doing. And it's been so rewarding to be able to work with her over that span of time and see these changes. Next slide, please. So another highlight is our participant, Mr. Ciolo, who I really hope if you go back through these presentations, please take a moment and watch this video. It's very short, but you get to kind of hear him give his own personal perspective of how joining a program like PACE made a difference for him. These are some of the quotes that he shared with us about what it's meant to him. When he first joined, he was very withdrawn, very shy. He wouldn't really talk much unless you came up and really let him know you expected an answer. And now he's greeting people as they walk by. He's made friends with participants who don't even speak the same language, but they sit together every day. There's one gentleman in particular, they sit and do puzzles whenever they're here at the same time. And that has been something that's made a big difference in his quality of life. And so it's very important to give people that opportunity that they may not otherwise have for, you know, struggles such as being able to get to a community center, feeling confident in getting out of your home, whether that be a fear of falling or mobility issues. So I really hope that you can take a moment to watch his story. We can go to the next slide. So this brings us to where our healthy aging and wellness programs are headed. We have the Rongchu Healthy Aging and Wellness Center that we are working on moving into later this year. It's very exciting. This is going to give us a chance to exponentially increase the number of people that we're able to serve with these program or with our PACE program. So this new center involves a memory care area for people that need a little more structure to their environment, and we can have, you know, more focused care on with activities that are appropriate for their cognition level. We also have a therapy gym where we're going to be offering physical therapy, occupational therapy. There's space to garden outside the building. We have a salon to help people tend to their self-care needs that they may not otherwise be able to meet. And with all the space that this new center will provide, it's going to allow us to continue providing culturally and linguistically appropriate meals and celebrations and performances that they may not otherwise get in other programs or other places. You know, we celebrate the popular Chinese holidays or other holidays that are special in our Asian and Pacific Islander populations. So it's a really exciting opportunity for us to move forward and expand what we're offering in terms of opportunities to come in and socialize, to meet other people, to find commonality with people you may not have been interacting with otherwise. So we're very excited to be, you know, being able to serve more and growing our vision here at ICHS. So I'm going to turn it back over. I thank you all for your time. Please let us know if you have any questions in the chat. Thank you so much. Oh, thank you. Yes, I will cover our key takeaways. Thanks. So to just bring it all together, as Jade laid out, our loneliness and social isolation concerns are a real thing. They are affecting more and more people every day, especially as our adults tend to live longer and longer. It doesn't only affect mental health, it also affects physical health. And it's a vicious cycle of if you can't get out and do things, then it just compounds your isolation and loneliness, which just makes it even harder to engage in your care or with your community and your environment. What we're seeing over and over again is that it is possible to intervene and provide either programs like PACE or just more involved medical care that takes loneliness into account, and it does make a difference in these people's quality of life, but also in the complications they face in terms of their health. We know that our immigrant seniors have a much harder time with this due to cultural and linguistic differences. So being able to find a way to provide a more targeted approach is so key, and especially helping our population. And using our connections with the community, our family members, caregivers, and the policies in place for healthcare all play a huge role in this. So I really hope that you guys are able to continue on with being able to see how we can make a difference for this population, and especially with opportunities like our new Ranchu Healthy Aging and Wellness Center. So thank you all so much for your time.
Thank you, Kelsey. And thank you, Jade. As someone who is in that sandwich generation, seeing the challenges that we face to meet the needs of our children and of our elders, what a relief to know that we have these resources in the community and that they are so impactful. This is also a great day to celebrate the Ranchu Healthy Aging and Wellness Center. That was just funded by the state legislature. It was signed in yesterday. So we're very grateful to Governor Ferguson and all of our legislative advocates for helping support that important capital project. So we're very excited to get this going. And now I'm going to turn it over to Braden, whose title as Director of Clinic Operations doesn't even cover all the things he does here for us. But Braden today is going to help us better understand the overall healthcare access challenges and how ICHS addresses it, how we meet people where they are. So take it away, Braden.
Perfect. Thank you, Melissa. Also, thank you to the ICHS Foundation, our sponsors, and all of you that are attending this wonderful event. My name is Braden Hirasawa. I am the Director of Clinic Operations here at ICHS. Next slide, please. What I first want to start off with is a personal story. Growing up in a family of five, one of my parents doesn't drive. So relied on the family to take them to their medical appointments or do daily tasks and needs. So when I look back at any kind of missed appointments, the difficulty, the stress that it could have put on my parent, one of the individuals. And I'm not going to say who because I don't want to get in trouble with singling them out, but is it working out?
There we go.
The internet
We're
crashed.
back. I'll quit dancing, Braden. I'll let you take it away again.
I apologize. The internet crashed. Thinking about the barriers that my parent had, just getting and scheduling their appointments leads into what our patients, our community, and individuals experience on a daily just to get to their appointments. So here at ICHS, when we talk about reimagining patient care, everything that we have done has led up and taken into fact of geographic location, needs, and the voice of our patients and our community. So looking at where we are is currently we have a satellite clinic at our ACRS with great partnership with them to provide medical care on site, dealing with serious mental illness over there. That's 2 days a week. Meeting our kids where they're at is school-based health centers. Community health centers do a wonderful job of building out school-based health centers at school. So being able to provide immunizations and medical care, well-child visits, behavioral health at the schools where kids feel safe and are able to access that care when they need to. Currently, we've recently launched our mobile medical. We'll dive into that a little bit later. And in part one, you heard about our mobile dental by my colleague, Cheryl Gray. We looked at opening up after-hours clinic for decreasing ER utilization and making sure that patients have access, the community has access to urgent and illnesses to be able to be addressed after hours and normal clinic hours. And then, of course, it was mentioned before, our Auburn Clinic partnership with Sound, which is coming soon. Next slide, please. So let's take a look at a little bit of the challenges of access in healthcare. So let's go ahead and click through, Travis. We can keep on. There we go. So, back one. So geographic is one of them. Barriers to transportation and distance for attending your medical appointment or your dental appointment. Financial is another one where the ability to pay can play a factor as a barrier for accessing care. Workforce shortage, we've experienced that coming out of COVID in regards to having the medical assistants and providers and everything, being able to provide those appointments and not having to cancel appointments down the line, but making sure that there is continued access. Complexity. Have you ever tried to schedule a specialist appointment? The system itself is complex. There's delays, there's wait, but getting access to the specialist is very important for the overall health of the patient. Cultural and language. We know a lot about this here at ICHS, making sure that the care is in the language and culturally appropriate for the patient that we serve. And technology. Technologies is constantly advancing with AI, advancements in MyChart and what have you, but making sure that we are able to provide education and resources for all ages as technology continues to grow. Next slide, please. Okay, so anyone that's lived in Seattle and knows the freeways knows what traffic is like during rush hour. Imagine sitting in this traffic trying to get to your medical appointment, or doing your daily shopping. So the importance of meeting our patients where they're at is to decrease that. So next slide, please. So let's think about transportation. A CMS Innovation Priority Study stated that 5.8 million Americans delay medical care due to transportation barriers. Now, those that have unmet transportation needs are 2.6 times more likely to report ER utilizations. And when we look at healthcare in general, we want to decrease the ER utilization and provide the right source of care. Next slide, please. So let's look at where our locations are currently. We have number 4 up there in Shoreline at farthest north, Bellevue at number 7, and of course, number 2, Holly Park. We have a mobile medical, which I'm going to go over, that is a little more flexible, being able to locate within King County to provide care. Next slide, please. So when we assessed the distance our patients traveled to make a decision about where do we go to provide medical care for our patients, we looked at where our patients, the most common patients, the distance from our clinics. So Holly Park, let's take the South King County, Tacoma, Kent, Auburn, Federal Way, Renton. There's about 4,000 patients that live in that area that travel to one of our 4 main service sites for medical dental care. When you look at the average travel time, it could be up to 26 minutes to an hour. That's one way. Think about going to your appointment, then coming back. We're asking patients to come 15 minutes early, factoring that in. And then you also factor in the complexity of having to coordinate care if they don't coordinate transportation, if the individual doesn't drive, similar to one of my parents. Now, when we opened up the mobile medical, we targeted specific cities to decrease. We looked at, okay, how can we decrease that travel time for our patients? And when we opened up at the YMCA Auburn Kent and via WACH, you see a significant decrease in travel time for our patients to receive their medical care. And the percent time saved, looking at 52%, 82% for Kent, 82% for Auburn, and then 56. So basically cut it down significantly to make it access easier for our patients. And when I go into patient stories, we'll hear about that. Next slide, please. So one of the key things when building out a mobile service, but also meeting patients where they're at, is targeting key community-based organizations or businesses. Via WACH was first at the table. A wonderful grocery store down in Renton. The idea there is that patients could not only get their medical care, but they can go grocery shopping too. They can not have to travel to multiple places. They could decrease the time and save time so that they could be with their families. They could do activities that they enjoy. So really targeted that. YMCA is another key community-based organization that we wanted to target because we wanted to get our patients knowing about activities, resources within the community. And the YMCA has been a wonderful partner out there. Next slide, please. So let me jump into a couple of patient stories about how it has benefited for our patients. An 82-year-old grandmother who lives 5 minutes in Auburn had to travel about 40 minutes to our Holly Park clinic. When we were able to open up the mobile medical clinic down in the Auburn YMCA, just 5-minute travel time, she could walk there. She didn't have to coordinate in what she felt like burdening her family to drive her to her appointment. It was more easy flexibility. It provided her continued independence, was less stressful, and improved financial stability, not to have to take time off from work too. Let me tell you about a 16-year-old patient who moved from Texas, where the father had concerns around acute mental illness. The father requested an appointment sooner, and we were able to get them in at the mobile clinic closer to her home. But the appreciative of how the care is that the father was stressed about having to bring his daughter into a clinic, into a lobby, and having an episode. So being able to bring up his car, have her go to the van and be seen in a personal kind of way, really alleviating any kind of anxiety or stress upon him. And let me tell you about a mother of two that hasn't had a well child check for her kids, but was able to be seen at the Kent YMCA. Again, very close to their home. They were able to walk to the location and also get their physical done and vaccines for the children. So being able to provide the care closer to where our patients in the community live is very important to improve the overall health of individuals. Next slide, please. So how does ICHS meet patients where they're at? You've heard from part one about navigating the healthcare maze. And here at ICHS, we have a wonderful care team, patient navigators addressing SDOH so we can look upstream. Community health workers, we have community health specialists that are out in the community providing health education. We have outreach and enrollment specialists making sure that our patients and community members are enrolled in insurance and they don't have to worry about financial barriers. Health home care coordinators, which meet patients at their home or a convenient location to provide care coordination. And of course, went over mobile medical performance of that and mobile dental. Next slide, please. So you may ask, how can we, as a community members, support each other? Well, one of which is let's strengthen primary care and community health organization. Advocacy is key. Making sure that funding for health care within the state is continues on. So talk with your legislator, make sure that funding isn't cut for healthcare. Engaging community members and organizations, making sure that if there is healthcare needs, let your local community health center or us know so that we can look at how we could best partner with the community. Technology, leveraging technology, assisting individuals with MyChart, scheduling appointments, and any kind of language barriers with that. And also, it's always key in healthcare promoting prevention, early intervention. If we could prevent disease upstream, then we wouldn't have to worry too much about chronic disease and high cost of healthcare later in life. Next slide. Oh, that's all for me. Thank you, everyone.
Thank you, Braden. That was awesome. My video's getting a little fussy here, so we'll give that a try. There we are. I'm back. Thank you so much. I'm really just sitting here thinking about how I take for granted that I can just take my kids for well child visits or vaccines, and just the impact that a mobile van that can go to people can have on a community and on a family and on a child is pretty telling. So thank you, Braden, for highlighting the important work we're doing to meet people where they need to be met. And that was really moving to me. Now, they were scheduled, but also backed by popular demand, our wonderful partners at the Washington Association for Community Health. Alyssa and Courtney are here, and they're going to answer more of your questions. They're going to talk about what's been going on. It's not like anything's happened in the last week. So please welcome back Courtney and Alyssa. Thanks for joining us.
Well, thank you so much, Melissa, for the warm welcome. We are so excited to be back. My name is Courtney Smith-Jiles, for those who were not here last week, and then I'm here with my colleague, Alyssa Patrick, who is our Director of Policy, Advocacy, and Communications at the Washington Association for Community Health. Just as a reminder, the Washington Association for Community Health is an organization that represents the 28 federally qualified health centers across the state of Washington. And among the 28 health centers, including you all, 1.2 million individuals in the state of Washington are served by those health centers. That's just about a seventh of the population of Washington state. This week we are back because things have continued to change in real time. So last week we were advocating in Washington, D.C. to protect Medicaid. Actually this morning, because it is Thursday, this morning, just before 7 a.m. East Coast time, we actually saw a vote on the floor of the House of Representatives about the Medicaid cuts that you might be hearing about in the news. And so we're going to talk a little bit about that today, as well as what the next steps are, how we're talking about these potential changes to Medicaid and the landscape changes at the federal level. And then again, just a reminder of how you can be engaged to protect those programs. So last week we talked about what we were hearing from the health centers, and the top line of what we talked about last week is that we're still in discovery phase. We're all of our health centers across the state are trying to figure out how they plan to navigate and how what changes need to be made at their individual health centers, which is difficult to do when there are many different ways that the federal administration is making changes. So today we want to go a little bit into specifically where those changes are coming from. And at the federal level, we're seeing really three areas of work within the federal government where changes are being made, and they all interact really specifically. So many of you have heard about the executive orders. We've listed the topical areas of them. We haven't listed the specific orders because frankly, there have been so many, it would be several slides to go through. But we're seeing the Trump administration since his inauguration continue to make executive orders in virtually every part of healthcare, and every element of how you deliver care to patients have been touched. Everything from prescription drugs to language access to workforce, and of course, how services are provided to immigrant populations, how grants are administered, and many different changes to gender affirming care. But just because an executive order has been made does not mean it actually results in immediate change. It is actually a directive to federal agencies to then implement that policy goal of the executive order. So the executive order is made, but then the agencies who are impacted then have to figure out how to implement. And that's where we're really starting to see the changes come through. So an example of this was temporary pause in all federal grant funds. We're starting to see changes to the terms and conditions for grant recipients in order to receive their funds. That's an example of how the agencies are implementing executive orders, and we're closely watching that. It's also an example of how the current administration is using every tool at their disposal to shape the healthcare landscape and to impact how care is delivered. In addition, the other place where we're seeing a lot of action that interacts with the new presidential administration, but also is ultimately led by the Republican majority Congress that we have, is through budget reconciliation. And just this morning, the bill that I referenced, also known as One Big Beautiful Bill, that's the title they've given it. That is not what I am calling it. It is the budget reconciliation bill that contains the proposed cuts to Medicaid that will be, quite frankly, quite harmful to community health centers and other care providers who offer care to patients who need it most. Last week, we had just seen, just a couple days before we presented, we had just seen the actual proposal that moved through the policy committee and was ultimately voted out of that committee, which included major cuts to Medicaid, including addition of work requirements, or it's also referred to as community engagement requirements. So individuals on Medicaid will be required to work unless they meet a set of exemptions. 10% reduction in the federal match for Medicaid services. Pause on new provider taxes, which is a mechanism used to maximize the available resources to states to implement the Medicaid program, and then stricter eligibility verification requirements. That was what was proposed, and we saw those things included in the budget bill that did pass the House floor this morning, and that did pass on a vote of 215 to 214. So it was a very close vote, but it did ultimately move. It now moves to the Senate. So what does that mean? There's all of those things. What does that actually mean for health centers? It means that you all, and I need to just pause and say thank you to everybody who is working on behalf of patients and adapting on a daily basis. You all have to keep finding ways to serve your patients. We heard really great examples of what you're doing, and I have no doubt in my mind that you all will continue to do that great work. But it is not lost on us that these cuts to Medicaid and the changes being implemented by executive agencies will make it more difficult to do that and will require a lot of effort on your part. And I just want to say thank you for continuing your commitment to patients and navigating this. We wanted to also share, ultimately, there's this big bill that passed. What does it actually mean? And this is what we're telling lawmakers about when we're talking to them about the impacts of the Medicaid cuts and why they need to oppose those Medicaid cuts. I'll stop with the top lines and then I'm going to transition over to Alyssa. But at a high level, this bill cuts $625 billion from the Medicaid program. That will reduce access to patient care, and it will lead to an increase, a 25% increase in the uninsured population of Washington state alone. In addition to that, we're estimating that these proposed cuts will result in anywhere from about 140,000 people to 281,000 people losing coverage, which will have a distinct impact on access to care. With that, I'm going to ask Alyssa to speak a little bit more on the messaging and talk a little bit more about these impacts and how we're communicating with our lawmakers about these impacts.
Yeah, thanks, Courtney. And I will note that unfortunately that $600 billion number is higher now that we've seen what actually passed the House. But this is an example of how things change day to day and hour to hour. And I do also want to note that the House budget passed. The Senate also now has to pass a version of the budget. It doesn't mean these things go into effect today, and there is still room for advocacy, and we need to keep up the drumbeat of advocacy, because while these cuts are still very significant, they are better than they could have been, and that is in part because all of the pressure that has been on Republicans, in particular, about the impacts of cutting Medicaid to communities. And so the continued messaging about that now needs to move to the Senate. And if you go to the next slide, these are the impacts that we talk about, like the specific bill that was introduced. When we're talking about health centers and Medicaid overall, and we're talking to our members of Congress, these are some of the kind of big key points that we make about health centers and why. Some of this is, I'm sure, obvious to all of you, but just kind of how we articulate how important Medicaid is to health centers, and why that's where we focus a lot of our advocacy at this time with the current threats. So, health centers serve a large portion of Medicaid patients, and a large portion of Medicaid revenue, or health centers largely depend on Medicaid revenue, and that's the largest portion of their revenue streams. So if that funding goes away, that makes it harder. Health centers have to find other ways to operate and stay financially sustainable. And then that health centers are really, and if make the best use of Medicaid is that, focusing on preventative care helps improve, of course, overall health, and with the goal of lowering overall healthcare costs as well. So, and then undergirding all of this is just the ongoing health center mission about serving everybody, regardless of ability to pay, serving all communities, providing comprehensive and affordable care, and being accountable to communities. So these are the messages that we bring to our members of Congress all the time, and some of the focus right now, given the current threats. And if you go to the next slide, we wanted to talk a little bit more about how advocacy is with our delegation, because every state, is comprised of different ideologies. And so in our state, we are lucky in that we mostly have members of our delegation who support health centers and support Medicaid and support our priorities. We are obviously, and this is true across both parties, we're a much more Democrat heavy state, but we, on the whole, the Democrats and Republicans in our state support health centers. Health centers have broad bipartisan support here and across the country. When you're thinking about congressional engagement and advocacy, things that you're looking at is who are the congressional members in your state that have decision-making power, that are on the committees where they can really influence things. And so in the Democrats, both of our senators are on key committees that have to do with the budget. And then Representative Schreier is, who's on the right there, she is on the Energy and Commerce Committee, which is where, healthcare issues get covered. And so that's where this ENC markup came up. So when we're trying to stop things from happening or encourage things to happen in that committee, we really talk to Representative Schreier a lot and the health centers in that district, and to our senators, because they have the most decision-making power. It's important for all of our representatives to know what the priorities are of health centers and to maintain relationships with them, because they can then advocate to their congressional delegations and their colleagues who are in more of those decision-making places. And then eventually everyone has to take a vote on something. So in the House, for instance, what happened is it was in an Energy and Commerce Committee, and then it went to the full House floor, and where all House members had to take a vote. So that's where, for this example of this recent bill, Representative Newhouse on the Republican side has actually become a national focus for advocacy, because he is a more moderate Republican, and our hope was for him to vote no when it got to the House floor, that he would, because the Republicans have such narrow margins, every vote matters. And so he was one that we were focusing on to hopefully get to vote no. And then Representative Baumgardner is new, and so we have to acclimate him to health centers and to healthcare in general, because that's not his area of focus as well. So unfortunately, Representative Newhouse did vote yes. That's just part of how we have wins and losses in advocacy. But we wanted to kind of give you this sense of what advocacy is like in our state. With the Democrats, they're largely wanting to support us, and they're asking us for stories and asking you all for stories and data that can help them advocate to defend our priorities to their colleagues. And then with Republicans, it is us trying to help them understand the real impacts of changes in their communities. But unfortunately, the two Republicans in our state, too, are not on the healthcare committees, so their level of influence is not as high. So I will then have us just go ahead and go to the next slide, I think. Where are we still? I know it's the news we saw this morning was not the news we wanted to see. But as I said earlier, there is still a long road in this fight. The Senate is not decided on. They have their own Republican divisions. So there is and we have good, strong advocates in the Senate. So continue to participate in advocacy if you haven't yet. It's never too late. So there's some links here that will go out with the slides to our Washington State Health Center advocacy, and then also our National Health Center advocacy organization. And that National Health Center organization is called NAC, the National Association for Community Health. They've had at least 30,000 messages go out. That's great, and we need more. So I think particularly signing up for those action alerts, if you haven't already, we would really highly recommend. And then, wherever you're engaging, all the other different community groups that you can help support right now in this uncertain time, like legal support for immigration and for folks across the gender spectrum as well. Like how are we need to be shoring up our legal support for different groups and our nonprofit organizations that are supporting different groups in this time when there's so much government uncertainty. So supporting health centers and community health organizations is a good way to help us keep moving forward as well. And then always also trying to take a breath, step away when we can, have your trusted news sources and community sources where you can go to help make sense of what's happening, because it's really overwhelming as well. So I will pause there. Courtney, anything else you would add?
No substantive additions from me, but do just want to emphasize and echo everything Alyssa said. We need to keep that strong and steady drumbeat going, even with our members who are super supportive of community health centers and Medicaid in general. The more we can do to arm them with messages to push back against any of these cuts, the better off we will be. And it takes everybody participating and rowing in the same direction to do that.
Awesome. Thank you guys so much. That is so helpful. We do have time for a little bit of Q&A, so I will kick it off with the first question. $625 billion is a huge number, but it's such a large number, and we don't have a lot of context for it. Can you help us understand what that means to Washington? What is that as a percentage of the total budget? Can you just offer a little bit of context of what kind of impacts that has on us?
Alyssa, why don't you start and I'll fill in?
Yeah, that sounds great. I don't have a sense of the percentage off the top of my head, but in Washington State, this you'd see, so the 25% increase of the uninsured population, that will have budget impacts in that, and that's in our state. So the amount of money with this, the state will not, a few things will happen. Eligibility, or not as many people will be able to be enrolled. And so then that means less federal match that's coming in for those individuals, and it makes it harder for the state. The state basically has to stretch its budget further to be able to make up for federal funding that's not coming in because of people losing their access, because of work requirements, because of reduction in federal match related to some of the communities that we choose to support in our state. So it would be a pretty significant portion of our state's Medicaid budget that would get impacted by this, and legislators would have to contend with that in community as well.
I think the other thing I'll just add to that is that there's an impact not just to the state budget, but then also individual CHCs. So as patients change the type of insurance coverage that they have, so as they move from Medicaid, if they're no longer eligible for Medicaid, they either become uninsured or they enroll in an individual marketplace plan or find insurance elsewhere. And depending on where they're receiving that healthcare, it may mean they show up to a community health center and seek uncompensated care or rely heavily on the sliding fee scale services that you offer, which means your federal grant dollars will need to go further to serve the uninsured population. Or they may be getting, their insurance elsewhere, but there is a high likelihood that folks may struggle to find that new insurance because of additional elements of this budget bill.
As a quick follow-up before we move on to the next one, if we're talking about more uninsured and people buying on the exchanges and having to buy those plans, is the federal government looking at any increases in support for those exchanges or keeping them open longer? We know that that's also shrunk quite a bit over time from the original way that it started. Is there any offsetting impact around that they're providing, or is this simply a full-on cut and we are to figure it out ourselves?
We're actually seeing, we're not seeing any offsets. The proposal that is now moving to the Senate does not contemplate any sort of support for those patients moving into the individual market. In fact, they're actually looking at reductions of APTCs, the advanced premium tax credits. So it will not just be that it's hard, that more folks will be unenrolled, that they will then have to navigate the marketplace. It's that the supports that are there are also being attacked and cut. So we are seeing direct challenges, frankly, to the structure of the Affordable Care Act through this budget reconciliation bill, which means patients will lose access to coverage and therefore care.
So it sounds like the bottom line of all this is that 625 billion or 25% increase or 281,000 people that will lose their coverage is but one part of a much larger ripple that's going to happen. So I think that's something that, it's not cause for panic, but then ties back to it is time to be paying attention. It's time to be advocating in that. So thank you both so much for helping provide a little context around that question. We have another question. Braden, if you are still on, one of the questions we have is what lessons were learned through COVID that you have been able to adapt to help meet the needs of patients today? I know that we went to all sorts of different online services. Healthcare really changed quite a bit. What takeaways from COVID can you apply to meeting patients where they are now?
I think the key thing after COVID, what we learned is providing the care. A lot of patients got used to virtual care from the comfort of their home, which is wonderful. But how do we ensure that all those regulatory necessary paperwork get done? So we had to definitely adapt a different way of providing care. And of course, we're looking at if Medicare telehealth flexibilities continues going forward. Otherwise, we don't want those barriers popping up.
Thank you. That's really helpful. And you guys, this is bringing us right on to the end of our day. Wow, that went fast. What an interesting hour. I do want to thank everyone for their thoughtful questions. I want to thank you for engaging with us. I want to thank you for joining us. I would love to highlight just what an awesome job the foundation team did. Well done, Angel and Travis and Teo and Debbie and Emma and Liz for putting all of this together, helping everything get done. This was a big transition to an online lunch and learn, and they just executed it beautifully. So huge shout out to that team. They worked really hard on this. Huge shout out to our partners who came together from across our organization and others to help present this. We know you have questions, so do we. I have more now than I did when I started, I think, around these cuts. And I'll also go to bed tonight and new ones will pop up. So while we may not have all of the answers and we may not know what our questions even are yet, we are going to continue sharing what we know. Part of figuring that out is having you respond in our survey. So please, please, please answer the survey that we're going to be sending out because we really do appreciate you engaging with us around these important topics. We all have to figure out ways to solve these problems together. So thank you again. Don't forget to fill out the survey. Huge shout out to everyone who attended. Thanks so much, everybody. Have a great afternoon.